Hi, my name is Lisa Huck. The name of my practice is called Thrive. My goal is helping people thrive in all areas of life. I don't want you wasting any more time with less than optimal movement. Dr. Mercola, through his countless educational articles and interviews with brilliant practitioners like Dr. Rowan, has taught us the high value of oxygenation. Oxygenation is at the core aim of the approach I'm going to show you. Oxygenation, along with many other integral benefits such as nutrient delivery, hydration, lubrication, and waste removal. Later, I'm going to show you how we can use these ideas in a totally new paradigm, a paradigm that Dr. Mercola has established of treating the cause, not just masking the symptom. When I first started teaching fitness over 2 decades ago, it was all about looks, looking leaner usually, sadly at the expense of health. Now, after working with thousands of people, having the privilege of learning from amazing mentors, and getting older myself, function is where it's at. How you feel. When you take care of the health of function, naturally good looks follow. Now I encourage people to move so that they can continue to move. It's not until you lose the ability to move, perhaps through pain, weakness, stiffness, or injury, that you realize how precious it is. The less we move, the less we are able to move. We move so that we can continue moving proficiently, with ease, strength, and surety as we get older, so we can feel great, to feel alive and vital.
Movement is a blessing. It's a necessity, not a luxury. The type of movement I teach now is called three-dimensional dynamic movement. It's all about blood flow. Opening up the nooks and crannies of the body, the areas that are normally compressed and deprived of the irrigation of life-bringing fluids, to nourish, oxygenate, hydrate, and lubricate. Movement should stimulate, not aggravate. The trend in fitness these days is adrenaline-driven. In a society of bodies that are already sympathetically dominant. Harder is not better. Three-dimensional dynamic movement counteracts the damages of daily life, softening the tightening, lengthening the shortening, decompressing the compression, clearing the waste, and replenishing the depletion. A proper program prepares the body three-dimensionally in diverse angles, positions, and motions, in contrast to the monodimensional movements of typical fitness today, so that we can do the activities we love to do in our world with confidence, strength, safety, and resiliency. This type of specific fitness, three-dimensional dynamic movement, cares for our parts as we get older, fortifying them. Unfortunately, most of what is popular today actually tears up our body. By uniquely combining dynamic, rocking-like motion with static holds, we accomplish the best of both mindsets of flexibility training, which is flushing and detoxing the cells, as well as lengthening the soft tissues, to maintain a supple, stable, happy, and healthy joint. Three-dimensional dynamic movement allows the fascial network, which pervades and connects every cell in the body, to stay supple, malleable, and hydrated, in contrast to many of the other modalities in fitness, which actually leaves our soft tissue dried out and full of adhesions. I've included a supplementary video called the Fuzz video by Gil Headley that talks more about the fascial ideas. This cutting-edge type movement can be done at a very intense level, or toned down depending on the needs of that particular body. Intense exercise has indisputable benefits, but sometimes, depending on the state of that body, nourishment and flushing, which is what I call clearing the waste, combined with the re-education, is a more appropriate phase. High intensity in these cases can drive the system further down the continuum of being overstressed. Proper movement keeps us young. It remodels and renews our structure. It fights gravity. Fitness is a gift. for each body at all ages.
Now I get to show you an example of how it all works. I just saw an article on Mercola showcasing Esther Gokhale and her discoveries and teachings. So the statement that lower back pain is epidemic in our society is no news. And like Esther, the platform for my approach is to address the root cause instead of just treating the symptoms. Although I do want to say that in many situations where a person's parts have gotten so aggravated and painful, you do have to calm the victim while targeting the culprit. After 25 years of having the privilege of working with the brilliance of the body's mechanical design, as well as embarking on a mission to find remedies for my own intense debilitating back pain, I believe that 80%, perhaps more, of back pain can be remedied or at least significantly reduced by the following ideas. When we improve and restore proper three-dimensional motion to the thoracic spine, the hips, and the ankles, we greatly relieve the adjacent joints, the neck and shoulders, the lower back, and the knees. One thing that the thoracic spine, hips, and ankles have in common is that they're structurally designed to rotate, while the other segments not as much. In this example, we're going to address the hips to significantly change how the lumbar spine is treated and how it reacts. The hip has a mass of muscles around it. This is the front of the hip. The hip flexors, or we also call them the iliopsoas muscles, are on the right and left side of the spine. There's 5 to 6 fingers of the muscle that start at the L5 and go, each one attaching to each vertebrae all the way up to the T12. That's where your rib cage is. So we start at the L5 and there's a finger all on each vertebrae on either side that goes all the way up to your rib cage. We'll use these elastic bands to represent the muscles. The iliopsoas has different fingers of the muscle that each grab at each vertebrae on the right and left side and run down together to merge into one muscle and then attach on the thigh bone, actually in the back. The muscle is a very strong, thick, and bossy muscle. Okay, so when a person's standing, the thigh bone's straight down. When we sit, it comes up. This muscle is attached to the back of the thigh, so when you're sitting, that muscle's in a shortened position. When you go to stand, that muscle has to have the length to lengthen. Sitting is the new smoking, but that's a whole other topic for another lesson. We know from studying muscles that when a muscle is in a position for more than 20 minutes, it starts to adapt to that position or length. Healthy, hydrated, supple tissue is like this. Tissue that doesn't get regular extension and contraction becomes more like this. Moving the tissues, and more specifically three-dimensionally moving the tissues, allows nutrients, oxygen, lubrication, and hydration to create a healthy intracellular and extracellular environment. One of the reasons why the three-dimensional aspect to the movement is so important is that it opens up spaces that are normally compressed and ignored by this vitalizing flushing effect. When we sit and don't move our tissues, they become like jerky. As we get older and the normal process of breakdown and rebuild happens in the body, more fibers are being replaced by collagen versus when we're young with elastin. Collagenous fibers don't have the same elasticity as elastin. So that's what happens as the natural process of aging. When we move consistently and in 3 dimensions, we cue the body that we want to continue moving in 3 dimensions. So the body continues to remodel with this in mind and lays down more elastin in the rebuilding process. We actually change the aging process. On the other hand, when we sit, we tell the body we don't need to move. So the rebuilding process employs more collagenous fibers over time, resulting in tissues that don't lengthen. The more sitting, and therefore the less nutrients, oxygen, lubrication, and hydration being delivered, the more jerky-like the fibers become. Jerky doesn't give. Which fibers do you want? Going back to the example of the front hip, when the muscles shorten from sitting, and if they're not able to elastically lengthen well, like that. When the person goes to stand up, it puts a tremendous amount of shear force forward on the spine. Well, you have compression force from gravity down on the spine. Over time, the vertebrae are compressing on the discs and you get herniations and bulging. Or you could even have ruptured discs. You see people who sit a lot, or even exercisers who cycle a lot, over time tend to lean forward. So those muscles being strong and bossy, pulling down and forward, arch that lower back. Although posture training absolutely helps this, more is needed to address the histology of the tissues. Now this is where we get to the real golden nuggets, the real key to success. If you look at the structure and design of the body, we see that form follows function. The femur head is very round, beautifully round, for a reason. Because we're supposed to have a great amount of rotation here. The thoracic spine at the facet joints also is built to rotate. By contrast, the facet joints of the lumbar spine have very little ability to rotate. There's only millimeters of tolerance there. So if we maintain proper three-dimensional motion at the thoracic joints and the hips, we don't ask the lumbar spine to rotate because it's not built to. We reduce wear and tear by taking care of the body properly. So for a person who's sitting for hours a day, that's sitting, like most of us, the front hip muscles get short and tight. And because the attachment is on the back of the bone, it ends up creating external rotation in that hip socket. Now for normal walking, we actually need internal rotation. We need this action. So this muscle pulling right here on this spine jams the facet joint. The bones have a skin on them. It's called the periosteum. The skin has nerve and blood vessels just like the skin on their flesh. If I continually hit the skin on my hand just like this, I'll irritate that skin. It will get red and inflamed. The same thing happens for the lumbar spine. When somebody is sitting often and that muscle gets short and tight and you jam that facet joint over and over again, that skin on the bone gets inflamed. It gets irritated and it gets more inflamed, and the vicious cycle of inflammation continues. If proper rotation isn't restored to the body at the thoracic spine and the hip, the lumbar facets jam. When that skin gets more inflamed, it takes up space, it creates more inflammation, and then that causes this whole area that has a mass of nerves to become irritated. Many times the person experiences pinpoint pain. That's actually the lumbar facets getting jammed. The pain can travel back and forth. All of this and the lower back gets the blame when it really has nothing to do with it. We need to maintain the parts to have proper rotation where we're supposed to rotate, the thoracic spine and the hip, so that the lumbar spine that's not supposed to rotate as much doesn't get chewed up. So we treat the cause, tight thoracic spine, tight hips, and the symptom stops sounding off, alerting us that we need to change something. Here's an example of just one of the exercises that I like to teach that would address this issue. It's called the front hip three-dimensional stretch, dynamic stretch. We move forward in this dynamic rocking motion to draw in blood, pull in the good stuff, push out the bad stuff. Then we move in all the different dimensions so that I'm really loving on that hip. All this different stuff pulls in the good stuff and pushes out the bad stuff. This is the gold right there, the rotation. I'm increasing internal rotation at that hip socket. We need a significant amount of internal rotation just for walking. And there you have it. My passion, my joy is to see people thrive. My desire is to bring this powerful cutting-edge concept of three-dimensional dynamic movement to the masses. It is easy, simple, highly effective, and something that all people can do with great benefit. One of the things that I love about Mercola.com is a similar interest in helping people to thrive by finding and delivering information about other possibilities. Thank you, Dr. Mercola, and your team for standing for other possibilities and making a difference in so many people's lives.